Early home medical treatment for COVID-19, and I want to emphasize early in home. And why do we want early treatment? It can actually reduce hospitalizations and deaths. So my opinion is we need to demand early home medical treatment. Hello and welcome. My name is Dr. Gary Murata. I am a medical doctor, a semi-retired orthopedic surgeon. And recently I got involved with treatment for COVID-19 because of close family, friends, and in-laws that have come down with COVID-19, and we've had an uptick, a spike of incidents of COVID-19 in our community, and they've asked for advice. And again, we are worried about hospitalizations and even death. And I believe the earlier we can treat a disease, the better the prognosis. And I want to give you an example of very late treatment. I took care of a patient through the emergency room approximately 3 years ago. He was a male in his early 20s. He was a massive recreational drug overdose, and the first responders found him quite late. He coded 3 times in the ambulance as well as once in the emergency room, and he required massive medical care, fluid resuscitation. He was in the ICU several weeks. He was on dialysis as he had multi-organ failure. And I was called as part of the team of doctors and nurses that took care of the patient. He needed an emergency leg amputation. And long story short, he actually did quite well. He woke up, he left the hospital in a wheelchair, alert and awake, and actually very thankful. His kidney function came back fully. And when I think about that today, when I look back on it, I'm thinking this patient should have never survived. So I would tell you that even in the most dire situation, there is always hope and a chance for healing. And in that situation, I just say, thank you, God. Thank you, Jesus. But again, early treatment is so important in treatment of COVID-19 that I've taken the choice and decided to treat. Now, the big problem with this Delta variant is I believe it is a resistant strain of COVID-19, meaning that even fully vaccinated patients are coming down with COVID-19. So despite being vaccinated or being unvaccinated, patients are still getting sick and they require treatment. And I think what's confusing out there is patients and people are confusing treatment with prevention. And when you think of prevention, we're thinking of vaccines. And the trajectory of this coronavirus is it's highly mutatable, meaning escape mutations are just going to happen. And when you have escape mutations, we have first-generation vaccines today that are not going to be as effective. So I'd like to show you the incidence of COVID-19 in 3 countries to demonstrate my point. A graph of the United States. Now this is incidence, daily new cases per day per million. And what I want to point out are the 2 peaks and the trough. The 2 peaks, the original peak was back in January, December, and this is actually when the vaccines were being rolled out. And you can see over time a precipitous drop in daily new cases per day all the way to June. And at that point, you say vaccines look very good for preventing COVID-19. And then unfortunately, the Delta variant hit. And the Delta variant, I would say again, resistant to our first generation vaccines. And again, the coronavirus, very mutatable. So what happens with the next strain, the next resistant strain? Are we going to get another peak? But be that as may, even today, whether vaccinated or not, many of these patients in this peak are either partially or fully vaccinated. They require early medical treatment. Why? To reduce hospitalizations and reduce death. So I would like to ask you, looking at the data, how well do you think our current vaccines are working? This is Singapore. And again, we're looking at new cases per million per day. And currently, making headlines, the Delta variant is hitting Singapore very hard. And many of these that are tested, many of the positive tests are in fully or partially vaccinated people. And on October 9th, 7 out of 11 new deaths, 7 out of 11, were either partially or fully vaccinated. So people are still getting sick. And again, I ask you, how well do you think our first generation vaccines are working against the Delta variant? And what happens with the next mutation, the next variant? So people are still getting sick. And this shows you that we really need early home medical treatment to avoid hospitalizations and death. The last country I want to quickly show you is India. Again, this is daily new cases per day per million. And India is also fighting the Delta variant. In all three countries, United States, Singapore, and India, we're all having trouble with this Delta variant. It's 99% of new cases per day per million. But India did have a real rough stretch back in March and April. And you can see a peak here in May. But what India did in that country, and this was according to Dr. John Campbell, YouTube podcast, September 22nd of this year, is they sent out healthcare officials in Uttar Pradesh and many of the states in India. And what they did was distribute medical kits. And within that medical kit is a medication I will show you. I don't know if you can see that medication. I don't want to say the name because of YouTube algorithms. But they distributed about 5 million of these kits. And what they did was distribute these kits not only if you tested positive. So if you tested positive, you were isolated and then given a medical kit. And these kits were not only given to the positive cases, but to close family members and close contacts. And what that meant was this medication I could be used for both treatment to reduce hospitalizations and death, but also for prevention or prophylaxis. So you can see that was a mechanism to reduce transmission and new cases per day in India. And they dramatically, as you can see, reduced their numbers. And today, even with the Delta variant, they're looking at 13 new cases per day. And compared with the United States, that's only about 5%. Now, India has a very high rate of natural immunity. And they do seropositivity tests for antibodies against COVID-19. And the way you become seropositive is you need to have had a prior infection and recover, or have had the vaccine. Now, India has a very low vaccination rate, in my opinion. 18% of the country is fully vaccinated. In Uttar Pradesh, only 11% of the population fully vaccinated. But what is interesting is 50% of school-age children in their random study have antibodies. So that means that probably around 50% of that population has natural immunity. And what we know is natural immunity is very robust, long-lasting, and at least 20 times better than vaccines for either breakthrough infections or reinfection. And I read that in a report recently from Reuters about seropositivity, random seropositivity tests in India. The other thing about India is not all states use this medication I in their medical kits. There's one state, Kerala, that did not use medication I, and they still have daily fairly high numbers. So this is a great example of epidemiology, patient population responding to a treatment. So you can't say for sure cause and effect that medication I was directly responsible for this low drop. I think natural immunity has also something to do with it, but you can't, the numbers don't lie. 13 new cases per day per million, which is extremely low with a highly transmissible Delta variant. So in discussion of early home medical treatment, this is, as a physician, where I am very frustrated and frankly disappointed. With established medicine and the CDC, what do they tell you to do when you first get COVID? Basically, isolate and do nothing. They tell you to hydrate, take over-the-counter medication like Tylenol, and rest. And this is what you would do with the common cold. So really, there is no home medical treatment from established medicine or the CDC on treatment for COVID-19. Now, this is actually very good. If you get very sick, you turn blue, have trouble breathing, altered consciousness, chest pain, yes, please seek medical treatment. I would be absolutely remiss if I did not tell you about monoclonal antibodies. Our past president received this treatment. It can be a game changer. It has excellent results, but it is not home treatment, so we're a bit off topic. But this treatment is performed at an infusion center. It is given intravenously or through your vein. So you have to get an order from your healthcare provider. You have to have symptoms. You have to test positive for COVID-19. And the criteria is age over 65, or if you are younger, you have to have certain risk factors. So go to this webpage. This is, again, great treatment, excellent results. And the good news is the NIH has recently approved monoclonal antibodies for post-exposure prophylaxis in certain high-risk individuals. So go to this webpage, and this is perhaps one of the most important things you can remember about early treatment for COVID-19. Getting back to early home-based treatment for COVID-19, I would direct you to the AAPS website. They have a 26-page PDF downloadable guide, and this is very complete. One of the contributing editors is Dr. Peter McCullough, who testified in Congress in Washington in November about repurposed drugs such as hydroxychloroquine and medication I. And he testified showing great results with early home treatment for COVID-19. And what I like about this guide is it stratifies care based on age and risk factors. So if you're younger, under 50, you may be able to get by with just taking nutraceuticals or supplements. And if you have higher risk factors, you may be a candidate for prescription medications such as medication I or hydroxychloroquine. So this is an excellent guide. The FLCCC also has excellent recommendation for outpatient treatment for COVID-19. And in the next slide, I'm going to show you my treatment program, but these guides are actually much better. So go to these websites, download the guides, look at what can be done at home to treat COVID-19 early. So this is informational. It's what I've used to treat COVID-19. Again, please look at the AAPS, their home treatment guide, as well as the FLCCC. They have excellent home treatment. I would just like to show you my thought processes about why I chose to treat and why I chose to use medication I, this medication here. So in consideration for safety of medication I looked at VIGI or VIGI Axis, and this is from the World Health Organization, their International Drug Monitoring System. And quite an impressive database. And if you look at medication I over several decades, they have 5,674 adverse reactions noted and no deaths. And if you compare this with other medications, and all medications have adverse reactions, but there have been no deaths even through clinical trials for COVID-19 today. Now, I'd like to compare medication I with over-the-counter acetaminophen. And over-the-counter acetaminophen has 168 plus thousand adverse reactions. So if you want to directly compare, medication I has 3% of adverse reactions compared with over-the-counter acetaminophen. And acetaminophen even has had a small number of deaths, and I'm sure this isn't associated with an overdose situation, but you can see the safety of medication I even through our current clinical trials. This is an article. We've been told that medication I is not effective for treating COVID-19, but this is an article, a large meta-analysis published in the American Journal of Therapeutics from the NIH. And the authors are Andrew Bryant and Tess Laurie. Again, large meta-analysis showing good efficacy, significant improvement of deaths when treating COVID-19, as well as secondary outcomes such as faster recovery and use of a ventilator. Also, it showed it was working well in prophylaxis, 86% improvement of infection when used prophylactically. This is an ongoing meta-analysis. It's very impressive from Ivmeta.com, an ongoing meta-analysis, 64 studies ongoing, and it shows a 66% improvement for many of the things that we are trying to improve on with COVID-19, like deaths, mortality, ventilation, ICU admission, hospital and recovery, 66% improvement with early treatment, and also 86% improvement when used prophylactically, meaning when used for prevention. So the results are very robust, showing efficacy for medication I. So I want to show you the Cochrane study. Where are we? Here we are from July of 21, and compared with placebo, their study of 14 trials show that compared with placebo, the medication I made no effect on the number of deaths or recovery or hospitalizations or even prevention. So this was a study that showed that medication I did not appear to be any different than placebo. So I want to go through my rationale why I considered using medication I. And safety was number one. If it was not safe, I was not going to consider the medication. Now, what happened here in this country, 88,000 prescriptions were written in the last week of August. So other physicians were also going through this process. But at that time, there was a skyrocket in number of prescriptions. And so the FDA, AMA, and the CDC came out with all these warnings about toxicity and overdoses. And what was happening was people were going out and buying horse paste or the veterinary version of this medication. And I would agree, if people are using veterinary medicine, it could be very bad. It could be toxic. But I'm only talking about the human form of this, or the pill form of this medication specifically made for humans. And for decades, the FDA considers the human form safe. It has gone through clinical trials. It's been around for decades. The World Health Organization considers it an essential medication. And we looked at the veggie axis, very low numbers of adverse effects over decades, and even in comparison with over-the-counter acetaminophen. So safety is not an issue. I believe it is it is a safe drug to use. Now, as far as does ivermectin work? Well, we have the Cochrane study. That meta-analysis shows that ivermectin does not seem to be shown to be any better than placebo. And that's what the CDC, FDA, AMA are all pointing to, these randomized controlled studies. We don't have enough, or we don't have proof. But there are studies out there that do show that medication I is effective. The Bryant Teslori study shows good effectiveness not only in treatment but for prophylaxis, and the ongoing meta-analysis also shows improvement in both of those areas. Now, the NIH and the World Health Organization consider this to be a medication that could or should be used in clinical trials. And we looked at epidemiology. We've seen improvement in India, but in Mexico City and in Peru, when this medication was given to the masses, also good improvement. We see an increased use in the USA, and there are a number of highly respected, even doctors that are in research that show good improvement with the use of medication I. Dr. Fareed and Dr. George Fareed and Dr. Peter McCullough in November of 2020 went to Congress and talked about repurposed drugs and their experience with hydroxychloroquine and medication I. And they showed in their clinical practice they had great results with these medications. Dr. Pierre Corey, 2 weeks ago in Congress, testified advocating for medication I, and he showed good results or great results with the use of medication I in his clinical practice. In my experience, patients are satisfied and very happy that they've been able to start medical treatment early. One of my in-laws, he got very sick. He's fully vaccinated. He actually works in the ICU and wanted to avoid hospitalization. So when he got COVID, he was given medication I, and he improved very rapidly. So is it legal, though, to give medication I? And it is entirely legal to give this medication I, because we use this medication as a repurposed drug. And repurposed or off-label drugs are used all the time. I use it in orthopedic surgery. I mix antibiotics with cement in total joint surgery. I use povidone and iodine, irrigate directly in the wound, not FDA approved in this manner, but I see a low incidence of infection. My cardiologist, he prescribes a beta blocker for me for my irregular heartbeat, and it works great. So 20% of the time, medications are used in a repurposed fashion or off-label. So as far as being legal, yes, it is ethical, it is compassionate. Imagine your oncologist not being able to offer another kind of chemotherapeutic because the FDA only approved it for another diagnosis. So in the midst of this pandemic, as a physician, we are looking for results. We want patients to get better. And we know with early medical treatment, patients are going to have a better outcome. So those are the reasons I chose to treat with medication I. You may have difficulty if you are a patient or physician getting a prescription I filled at your local pharmacy. I've had a lot of pushback from many pharmacies, so don't give up. You may be able to get the prescription filled at a compounding pharmacy or another pharmacy in your area, but they also have website pharmacies, and I'll try to put the link from the FLCCC for website pharmacies. Now, I'd like to close by talking about our overall health and what we can do for COVID-19 by lifestyle change. And I don't think we talk about a lot of these things enough. The CDC certainly doesn't talk about it at all. But I never met a donut I didn't like. I just love the little guy with the round hole in the middle because of my sugar addiction. But because of body shaming and political correctness, we do not talk about obesity in this country. But obesity is the biggest risk factor, the number one risk factor that is associated with hospitalizations and death with COVID-19. So we really need to do something about that. Some of the things you can do for COVID-19 are very easy, like taking the supplements, the vitamins, zinc, and I should add quercetin. Quercetin can be very important for your immune system. The others are very difficult, and for my sugar addiction, it's trouble not feeding the beast. My dopamine pathway is firing on all cylinders. So my wife and I, Rose, we just try to avoid the donut line at church. We try to eat better with less processed foods and less sugar. We try to get a little more exercise, fresh air, outside in sunshine. You can stimulate vitamin D. So these are just simple things you can do to be healthier. And some of these things are great for even chronic diseases such as diabetes and heart disease. So remember, two things from this presentation: monoclonal antibodies, IV, prescription from your doctor, and early home medical treatment. And you may want to keep, just in case you test positive, keep prescription I or hydroxychloroquine in your medicine cabinet at home even before you get sick. So remember, there is always hope and a chance for healing. Look for the links below, and thank you for tuning in.